We're going to give people just another minute to log on, and then we will begin the formal presentation part of the conference, of the webinar. So, okay, 1 minute has gone by. Again, I'd like to introduce myself. We've had a number of more people join us. Good afternoon. My name is Amy Weinstein. I'm the Executive Director of a Kids Brain Tumor Cure Foundation, also known as the PLGA Foundation. Welcome to this afternoon's webinar entitled Supporting the Educational Needs of Pediatric Brain Tumor Patients. Before we start the webinar, I just want to go through a few housekeeping items and make sure that everybody, first of all, can see the screen. If you are, can we back up one slide, please? If you are on the webinar and you're looking at the screen, the full screen, you should be seeing the logo for a Kids Brain Tumor Cure on the top. And then on the bottom right, you should see two smiley faces with their fingers up, thumbs up. If you're not seeing this, then my recommendation is that you go to the down arrow for Zoom, which is at the top, should be at the top left of your screen. Click on Scale to Fit option. Now you should be able to see the full screen. So I'm just going to give everybody just a second to register that. If you're still having technical difficulties with the screen, I would encourage you to use the question option, which should be on the lower right-hand side. You can ask us questions, and we can try to address it. Okay, next slide, please. A few other housekeeping items. If you're having any audio issues, please mute your computer and call into the conference number from preferably a landline. The conference number would have been provided to you in your email invitation. The phone number is a U.S. number, so if you're calling from outside of the United States, just remember you probably need to use a country code. And hopefully everybody can hear me. Okay, so to give you just a quick overview of what to expect on the webinar, I'll be speaking for the next few minutes, and then I'm going to introduce our main presenters today, Lisa Northman and Mary Beth Morris, who are both from the Dana-Farber Cancer Institute School Liaison Program. They are going to do the webinar for about 30 minutes. They have some prepared content. At the conclusion of their remarks, we're going to have about 15 minutes to address any questions that may arise. And the way that the webinar attendees should register their questions is, again, through that question box I referenced a little bit earlier. Should be on the right-hand side of your screen. And you're welcome to send us your questions. We will do our best at the end to answer as many questions as possible, but of course we may not be able to get to all of them. We will compile the unanswered questions after the session, however, and we will send an email to all participants with answers to those questions within a week of the webinar. So we just want you to really just know that we are going to try to get to as many as we can, but those that we can't, we will address shortly afterwards. Also, I want to remind everybody this webinar is being recorded. We will distribute a link to view the recorded version, again, post webinar, probably within about 48 hours. Okay, just a little bit now, next slide, about a Kids Brain Tumor Cure Foundation. For some of our audience members, you know us well, and some we are new to you. We are known as a Kids Brain Tumor Cure Foundation, also known as the PLGA Foundation, Pediatric Low-Grade Astrocytoma Foundation. We were founded in 2007 due to the lack of scientific research in the pipeline for the most common forms of childhood brain tumors. And the foundation at that time set out to rally the research community around this disease. 8 years later, I am really pleased to say that we've raised over $14 million, and we have definitely helped put PLGA research on the radar, for all major medical and scientific institutions across the country and, quite frankly, across the world. So the mission of the foundation is threefold: to expedite the pace of bringing targeted drug therapies from bench to bedside, to unite the pediatric brain tumor community, especially the research community, with the shared goal of changing outcomes for children battling brain cancer today. And finally, to support the families who have children battling brain tumors by providing them with online resources and information and opportunities for them to connect. But the question that that I have to answer most often from families is, why? Why would we need to have a foundation like a Kids Brain Tumor Cure to fund pediatric cancer research? Isn't the NCI or other large cancer foundations already doing this? Next slide. And the answer was no. And as many of you know, if you're on this call, you already know that the current gold standard for treatment for children battling brain tumors is over 30 years old. We have 25 plus here, but really we're bordering on 30. And those treatments are toxic and largely ineffective. In addition, there was a lack of pipeline research projects, and it was stemming from the lack of funding and therefore the lack of researcher interest at the national, governmental, and foundation levels. But now what's happening is that with increased attention in the research community and fundraising efforts of organizations like a Kids Brain Tumor Cure, what we're beginning to see now is a steady flow of projects that are entering the pipeline, some of which are resulting in new drugs and new trials that are actually going to be opening up within the next couple of months. So what we're doing really is trying to break the doom loop for this particular disease and for all children battling brain tumors. But our goal today is not fundraising and it's not scientific research. It's really to support our families. And so it is my pleasure to introduce to you today the main feature, Mary Beth Morris and Lisa Northman. They are both school psychologists from the Dana-Farber Cancer Institute and Boston Children's Cancer and Blood Disorders Center. And they are going to talk to you today about ways that you can support your children in their academic pursuits. So Mary Beth and Lisa, I'm going to turn it on over to you.
Thank you, Amy. Good afternoon, everyone. Thank you so much for joining us today. This is Mary Beth. I'm going to be going through the slides with you, and then Lisa will join us for the question and answer portion of today's presentation. And our goal today is to talk about how to support your children's educational needs throughout their academic careers. I'm going to do a very brief overview. We're going to talk very briefly about late effects. I'm sure those of you who have gone down this path with your families have heard about late effects, although sometimes going back over that into the survivorship phase is very helpful. We're going to talk about how to seek out an assessment and some of the key components of assessment, some common interventions that we often recommend in our program here at Dana-Farber Boston Children's for our patients and families. And then I'm going to go into a little bit of detail about the model of care that our school liaison program utilizes and how you can seek support in your individual institutions. So I think the first question is, what are late effects? As I said, many of you will have discussed late effects with your primary oncologist at some point in your child's diagnosis and treatment course. But late effects look different for every child and every student. And they vary by diagnosis, by age at diagnosis, and then at what point out from treatment that you can be. They do require specialized monitoring and follow-up care, and this is why many of our families and patients continue to meet at least annually with their oncologist well into many years following survivorship. Their risk factors for late effects fall into two main categories. We're looking at treatment factors as well as individual factors to the patient. So treatment factors, as you can imagine, those students with, those patients that have undergone a more aggressive course of treatment are at greater risk for toxicity and thus a greater risk for late effects. Individual factors, again, have to do with each individual child and what they're coming into treatment with, as well as the age and developmental stage that they are when they are treated. As you can imagine, a younger child who is at a more critical juncture in their development is likely to be at greater risk for some late effects moving forward into survivorship. Late effects can fall into a variety of categories. I'm going to be focusing primarily on late effects that impact school and education, but as you can imagine, there's medical late effects as well. One of the things that we see primarily among our pediatric patient population in the many years following treatment is ongoing fatigue, particularly for those patients who have undergone cranial radiation. Schools often don't understand fatigue, and they don't understand why children continue to have this issue many years out from treatment. And I think sometimes it's mischaracterized as a lack of motivation or a lack of interest in school. The other pieces that we see primarily impacting a student's schooling are fine and gross motor impairments, as well as sensory impairments, such as hearing loss or vision changes. Um, Again, the bulk of our talk today is going to be around neurocognitive late effects, or how learning is impacted and school functioning is impacted by pediatric cancer diagnosis and its treatment. And primarily here, we're going to be focusing on those students who had central nervous system involvement. The bulk of those students, all of your brain tumor population, will have had central nervous system involvement. And then there's other pediatric cancer populations who, although the diagnosis itself did not affect the central nervous system, the treatment would have some central nervous system impact. These neurocognitive late effects can be quite outstanding, but they can also be subtle and not necessarily observable or recognizable to parents and to school personnel. And despite the fact that they are subtle, they can have a significant impact on a student's education and their educational trajectory. This is certainly not an exhaustive list, but you see a list here of some of the primary late effects that we are dealing with when working with our patients and families here in the School Liaison program. We see memory, visual and spatial processing, auditory and linguistic processing, attention and concentration, and then a big buzzword the academic community in general is hearing now, but one of the things that we see in the vast majority of our patients and students is issues with executive functioning. And I'm going to go into a little more detail about executive functioning today. Executive functioning is really an umbrella term for neurologically based skills that are looking at how a student approaches and organizes oneself around a task. When your child is faced with a task at home or in school, are they able to understand the steps they must take in order to complete that task and be able to carry out those steps and recognize when they may be getting off track? And that is often a challenging area for many students, but in particular for the pediatric cancer survivorship population. Children who struggle with executive dysfunctioning can have one or more of the list that you see before you. Really being able to start or initiate a task, plan oneself around that task, hold information in the mind while they're completing a task. So you can imagine a math problem, for example. You have to be able to hold those numbers in your head, manipulate them, and give out a response. And that can be challenging for children who struggle with executive functioning. Emotional control is also difficult for these students. And again, not every student who struggles with executive functioning is going to have difficulties in the areas you see before you. It may be one, it may be a few, it may be all of them, and it varies from student to student. And I think, again, what often is difficult in dealing with your child's school team if your student is struggling with executive functioning is that particularly as your child gets older, it can be misconstrued as a lack of motivation or a disinterest in school. And so really understanding risk factors and understanding how executive dysfunction presents itself will be important in strategizing and how to best support your child throughout their academic career. So as you can imagine, late effects can be very subtle, and we want to make sure that we're keeping an eye out to ensure that we're proactive in getting the supports that our students need. As with any child, what would present itself as a late effect could be, frustration with schoolwork. Your child is starting to decline in their grades. We often hear for those students who are a little bit older when they're diagnosed or treated that they're recognizing a difference. This used to be so easy for me, and now it's really challenging, and I don't quite know why. I'm still working really hard. I'm still asking the questions I used to ask, but I just can't get it. I can't remember things. Everything takes me so much longer. And when you start to see these signs is when you want to start to work on working with your child's school and intervening so that we can provide the supports that they need. And how to do that and how to really get at the heart of the struggle that your child is having is through an assessment. Assessments can look different. They can be conducted in different settings. But what we want to really do is establish a baseline of functioning. And we often hear from our families, do we need to test before treatment? Do we need to test before diagnosis? And that can be challenging. I think there is certainly a push to want information about how your child is functioning up front before we expose them to treatment. But that's not always possible. You can imagine, and I'm sure you've all been there, you get the diagnosis, you want to start treatment and work on getting your child well as soon as possible. And that doesn't always allow time to have a full evaluation. Additionally, this is a stressful time for you. It's a stressful and emotional time for your child. And testing your child right after diagnosis may not get optimal results or a clear picture of how he or she is actually functioning neurocognitively. So that's my very long way of saying that baseline testing is not always possible and it's not always advisable. We do have some students who come into diagnosis and treatment having already had learning needs, and so that's an ideal situation when we have some baseline results of how that child was functioning before the diagnosis or treatment. But what we do recommend is as soon as possible after treatment and when your child is feeling well and when the medical team feels as though we're going to get a clear picture of your child's functioning, seeking out testing at that point would be recommended. And again, really the result of that evaluation is looking at how your child is functioning as an individual and recommendations that may best support that child. Assessment is really used as in determining what kind of supports the school is going to be able to provide as well. And then again, over the course of the years well into survivorship, we would look at reassessing a child in order to get updated information about their progress as well as areas that we may need to continue to monitor. A good and thorough assessment is going to look at all of those risk factors for neurocognitive late effects that I spoke of earlier. So we're looking at cognitive ability or your child's IQ and intellectual functioning, processing speed, how they're doing academically. Again, you're going to use this assessment data in conjunction with what you're seeing on a day-to-day basis, what your child is voicing as concerns, what the teacher's concerns are. Again, for students who are having difficulty socially or emotionally or adapting and presenting like a child should be at a typically developing pace, we look at those areas as well. And I'm talking about assessment, and there's two main resources we want to look to in order to seek out that assessment. The first is a school-based evaluation. For those of you here in the U.S., you are entitled to a school-based evaluation if you, your child, or your child's school team has concerns with his or her functioning in school. And if a parent requests a school-based evaluation, the school is legally obligated to provide that. They have 45 school days in which to conduct that assessment. And that's really going to look at, again, their cognitive functioning, their achievement, their adaptive functioning, sometimes attention and executive functioning can be a piece of that. And the school is going to use that in determining the appropriate supports and whether or not your child is eligible for special education. Some of the benefits of a school-based evaluation is that you really have your child's school team at the forefront of that. So you're going to be able to have those assessing your child not only look at testing results, but also look at observational data from how your child is presenting in the classroom. Those evaluators also have direct access to your child's teacher, so they can get a sense from the teacher how your child is presenting in the classroom on a day-to-day basis. Another wonderful resource for assessment is a neuropsychological evaluation. And typically this evaluation happens in a hospital setting or at a private practice community-based setting. And one of the benefits of this is it is a much more in-depth battery of tests than what a school system is going to be able to do. And they're really looking at the processes behind how your child is presenting. How does your child encode information? How do they store that information and retrieve that information in order to give responses or perform in the classroom? And again, both of these types of assessments will also result in some very specific and individualized recommendations on how best to support your student in the classroom. So the next step we want to look at, we have all of these concerns, we have all of this assessment information. What do we do with that? What are our next steps? Where do we go with this information? And really what you want to do, whether you have the testing in school or whether you have the testing at a hospital or community-based setting, is sit down with the school team, talk about results, and discuss your options. There are two here in the United States. There are two main support plans that we generally see students having. One is an individualized education program, or an IEP, which provides special education services to a child. The other is a Section 504 accommodation plan, which is through the Office of Civil Rights, and that really looks at accommodations for the child who has an identified disability and is struggling in the classroom in order to give that child, level the playing field, if you will, for that student. And in order to qualify for one of those plans, it's really a team decision, and the team can include the parent, it can include medical personnel, it can include a social worker, and it also includes all of those support personnel at the school. And that is a very detailed meeting, and that can also be a very emotionally laden meeting for parents. So my recommendation to parents is to often go in with a plan, make yourself notes. I know everybody goes in with ideas in your head of what you want to cover, but as the ball gets rolling and you're starting to talk about your child and having difficult conversations perhaps about their functioning, sometimes things get lost. So go in with a plan, share with the school what you want to make sure that you cover in that meeting. Oftentimes the meetings can be upwards of 2 hours, but sometimes given the school day, they can be limited. So we want to really get at the heart at what you need to discuss. You want to talk about your concerns and make sure that those are heard in that meeting. You can certainly, parents, for students on a plan, you would meet at least annually, but you can request a meeting at any time that you're having a concern. And you can also, if in that first meeting you don't feel like your concerns are heard or you don't feel like an acceptable resolution is met, you can request a second meeting within the next week or so to continue the start and make sure that you and the school team come to an appropriate conclusion about the appropriate supports for your student. So as I mentioned earlier, there are two main support systems here in the United States for students. They can be an IEP or a Section 504 plan. Students on an IEP that require special education services, we're really looking at specialized academic instruction. Does your child need something different than his or her more typically developing peers in order to be academically successful and make progress? And what that support looks like varies on an individual basis from student to student and can look different depending on how different school districts approach it and what supports that they have in their school. Some students receive small group instruction outside of the classroom for specific skills like reading, math, or written language. Other students receive that support in the classroom. Again, the school team really needs to go by the individual child and what they need in that moment. And that can be fluid. Again, IEPs are typically developed for about a year, but that does not mean that if there's some sort of change in a child's functioning, you can't come back to the table and reconsider what those needs are. Many of our students, particularly our brain tumor survivors, require therapies in school: occupational therapy, physical therapy, speech-language therapy, study skills training, counseling. There are many options available in school districts that many parents aren't aware of that can benefit their child and make sure that that child is in an optimal position to achieve academic success. For those students who are more significantly impaired, there are other options either within or outside of your neighborhood school district. So for example, students who are not able to be successful within their mainstreamed classroom or with pull-out supports may need a substantially separate program within their school geared more toward their needs. And what we're thinking about here are more students who have intellectual impairments or may have a language learning disability that requires a specialized approach that's really embedded throughout their day. There are some cases where students in a substantially separate program within a district are still not able to be successful. And in that case, we need to look at out-of-district school placements in which your public school district will have to financially support your child being sent to a private placement, specialized special education placement within the community that is geared specifically toward those needs. That is a challenging and long process, but it is a certainly successful process for many of our students who are more impaired and need a greater level of support. As I mentioned earlier, both IEPs and 504 plans can include accommodations for students. And I'm going to go through the next slides in the interest of time fairly quickly. You will have them in front of you. And again, as Amy mentioned at the outset, this webinar is being recorded, and you'll be able to access this information at a later date. But what we're really looking for is how can we best support that student in the classroom? How can we level the playing field so that child is able to meet his or her maximum potential? And so, for example, I've broken it down into different areas of difficulty. So for a student with organizational challenges, we're looking at how to seat them in the classroom so that they're in close proximity to the teacher and able to get that support. How do we structure the classroom so that organization difficulties are minimized? For students with memory difficulties, we may provide specific scaffolding or structuring of information in order to increase those skills and abilities. Children with hearing or vision impairments may need specialized equipment or specialized settings in the school in order to be successful. And then again, multisensory teaching for children with more specific learning or cognitive issues can be helpful using a more hands-on approach. For those students who were concerned about the gap over summer or school vacations, how do we reduce that loss? Do we need to provide services throughout the summer in order to start off a new school year on correct footing? And again, processing speed accommodations. Here we run a really maximize what a student is able to demonstrate. So if we need to provide extended time or modify the work so that we're really looking at the quality of the output as opposed to quantity. For many teachers, reducing that busy work so we're really getting at the heart of the lesson and so that students are able to demonstrate their knowledge in a way that is feasible for them in the time that they have. So the skills and the approach we would take may vary depending on a child's age. And as you can imagine with your children, they look very different from elementary school to middle school to high school. And the challenges that are met for any child at those age levels will vary. For elementary school, we really need to consider not only the academics, but how behaviors may impact a child in the classroom. We're looking at the whole child and what they're coming in with at this particular age range. Many children in elementary school, we really want to focus on those foundational supports and give them the support that they need in a maximum way in order for them to demonstrate their skills and continue to make progress. And that can look like anything from a behavior management plan to accommodations to specialized services. It really varies, again, based on the individual, but we really want to look at how that child is presenting at that time and what factors that are related to a child's age come into play when how to best support them. For those of you with preteens or teenagers, we know that at that age, what's really most important to that child is that they fit in and look like their peers. And at this time, we generally see a lot of our patients wanting to kind of reject some of the supports that they got at an early age. They don't want to be the child that has to pull out a laptop because that's what's helpful for them, because it makes them look different from their peers. They want to have all, the same materials and do the same amount of work. And that's not always feasible for our pediatric cancer survivor population. So we really need to look at how do we allow that child to fit in, if you will. How do we help them to become more independent while at the same time supporting them in a way that makes sense and is going to help them continue to make progress. Some students at this age really want that support in the classroom, because being removed from the classroom can be really challenging for them, can make them wonder, is everybody wondering why I'm pulled? Why am I going with Mrs. Jones when everybody else is staying in the classroom? So we really want to think about what's going to feel best for the child at this age, while at the same time giving them support. On the flip side of that, some children in middle and junior high school really want that support outside of the classroom where it's less visible to their peers. Um, this is a stage in a child's education, for any child, where really the expectations increase, um, and the information complexity increases. So we have, thinking about middle and junior high school, a student is now going to have multiple teachers with multiple systems for doing things, and they're getting homework from various school personnel, and they have teachers for a shorter period of time who may not get to know them as well as their classroom teacher in elementary school. So we really want to look at whether or not a support period outside of the classroom, where we're teaching strategies and how to manage those multiple expectations, and providing, someone who's going to oversee and case manage for this student, so that they're able to get what they need in a supportive environment that feels good to them. And then we move on to high school, and it really kind of ups the ante in terms of students really, really not wanting to be different from their peers. But we're also recognizing that this is a critical point in preparing these children for what happens beyond formal schooling. So how do we prepare these students for independence and make sure that they have the tools that they need for when they walk out of those high school doors and go to college or move on to the workforce? And that's where we really are looking more specifically at functional skills, life skills, and strategy instruction. And that can be take shape in a variety of ways. High schools often are able to tailor classes for students in a way that may really focus on the things that they need, and maybe reduce some of those pieces that may be more challenging for the student and may not benefit them moving on. So in other words, some students in high school only need to take 3 years of math instead of 4. And if their career aspirations do not involve math, that's a way that we can reduce some of that pressure in order for that student to really be able to focus on what's going to be most important for that child. It's at this level in high school, I would say about the age of 14, where you want to really start involving your child in decision making. So have that child come to those team meetings, and talk about what's challenging for them, and talk about how they feel how they feel best supported, what makes the most sense for them. Having them involved and invested at this point will serve them well, not only throughout high school, but also beyond high school, learning how to advocate for themselves and the supports that they need moving forward. I'm going to switch gears a little and talk about the service delivery model that we provide here in the School Liaison program at Dana-Farber. We really are multifaceted in that we work closely with families, with school teams, with the medical team here at Dana-Farber and Boston Children's, and also any community-based providers that may be involved with our patients. We participate in school meetings for our patients up to a 60-mile radius at Dana-Farber. That's not to say we don't serve patients and families beyond that radius. In that case, we would do phone conferences. So we participate as much as wanted and needed in school meetings for our patients. One thing that we often recommend is that at the start of each school year, that parents have a meeting, and formal or informal, it really depends on what's most comfortable for the family. But because at the start of every school year you're working with new teachers and a new school team, it will be important to give that team a snapshot of your child. They're going to get paperwork about your child. They're going to look at an IEP or look at their file. But really, you as a parent are the expert on your child, and you can bring your child's history and your child's needs and their strengths and weaknesses to light for that team. And we like to participate in that as well, to remind teams that although a student may be 5 or 10 years out from treatment, the cancer experience is still very much with them in a social and emotional way, but also potentially in a neurocognitive way through late effects. We do like to observe our students in classrooms whenever possible. Again, we see children in the clinic-based setting. And so being able to see them in the classroom and how they're presenting in the classroom also brings your child to light for us and helps us to be able to advocate and support them in a maximum way. Here at the hospital, we do participate in clinics, so we will see patients when they come into clinic and get updates from patients and families when they're visiting for their medical appointments here at Dana-Farber. And then, I spoke at length about assessments earlier. We ourselves do not do assessments in our program, but we work very closely with the neuropsychology team across the street at Boston Children's Hospital, and we will attend feedback sessions with our patients and families so that we're able to take the information garnered through those evaluations and bring them into the school and help work with school teams and families to develop a support plan that reflects the needs of a child. So here are some general data about the types of supports that the patients and families that we work with in our program access. So many of our children have special education services both in and outside of the classroom, the large majority. As you can see, it's a lower percentage of those students that are in a substantially separate classroom. And again, these are our students with greatest need and who have had the largest amount of deficit related to their diagnosis or treatment. And then again, a large majority of our patients do require therapies in the school setting, whether it be speech therapy or PT or OT or social skills counseling as well. Here's a snapshot of some of the services we provide to our families. I know I went through some of that, but that gives you a sense of percentages for our overall school liaison program population. And then as you can see here, there was a significant difference in services and supports that we saw both before and after involvement in the school liaison program. So the blue bar on the left you'll see is the types of services and supports that students were getting prior to involvement in our program, and the gray bar on the right are those supports and services that our students were receiving after having been involved in our program. And as you can see, those students with 504 accommodation plans decreased after involvement, and the hypothesis is that many of those students actually transitioned to an IEP or a special education plan after having been involved with our program due to the recognition of a greater level of support needed. So you've had some information about what our program looks like, and I'm sure many of you who are not patients here at Dana-Farber or Boston Children's are wondering how you can seek support in your own institution. And although programs such as ours are more rare than not, there are many hospitals that offer some level of support for the survivorship population in accessing school services. Our first recommendation would be to ask your child's oncologist to identify an appropriate member of the hospital care team to act as a liaison with the school. And in various institutions, it could be a social worker, a psychologist, a hospital teacher, child life specialist. It takes different forms depending on where you're treated, but there generally is someone on the staff that can help you. I've also heard at many institutions there's a nurse on staff who plays that role. But really having a point person from the hospital perspective to kind of bridge that information to the school is strongly recommended. On the flip side of that, you also want a point person on the school team. Many of our children come into school with various professionals working with them. You have teachers and special ed teachers and therapists and the school nurse, and having a point person on that team will be important. Throughout treatment, the point person is oftentimes the school nurse. My recommendation is when your child enters into survivorship and managing the medical needs of your child becomes less at the forefront, you really want to move beyond the school nurse and find someone on the teaching team to act as that point person and to be the contact person for the hospital liaison. And again, you want to request a hospital or community-based neuropsychological evaluation. It is recommended that although you may have had a school-based evaluation and your child is on an IEP, having that more in-depth testing may provide some more information and give you a better sense of what your child's going to need, not only now, but in the years to come. Your medical team at the hospital can not only help identify the appropriate person to conduct that evaluation, whether it be someone in your hospital institution or in the community beyond, but can also provide some information to your insurance company to help get that testing covered for many of our, particularly for our brain tumor population, but for many of our pediatric cancer survivors, there is some way to get that covered from an insurance perspective. Again, you want to meet with your school team at least annually, but at any time you have concerns, you can certainly discuss that with your school team. And then consider becoming involved with your child's special education parent advisory council. Every school district here in the United States is obligated to have that. It can be just as simply as Googling it online with your school district, but it can be a valuable support system for you as parents in talking with other parents who have gone down this road, whether it be because their child is a pediatric cancer survivor or for other learning needs, but it can help you get the support that you need in navigating the system in which you're living. So I know that was a very quick and quick way to get through a whole lot of information. I think the key points that we want to take away from this is that although you're through the bulk of the treatment and you're onto survivorship, which is extremely exciting, it's very important to continue to communicate with your child's school team throughout survivorship to make them aware that late effects exist, and so that you can be proactive in providing your child the support that they need to continue to make progress throughout their school years. We have found that following patients throughout their academic careers up through high school graduation really gives us the chance to provide the supports that they need throughout their developmental trajectory, and as late effects start to emerge, to really be proactive in providing those supports. And then whenever possible, if there is someone from your hospital-based team who is able to interface with your child's school in person, that has been extremely beneficial to us as providers, but also to parents and school teams to really feel like we're a team. And although not many hospitals are able to send a clinician out to the school, with the technology that we have today with FaceTime and Skype, it really has opened doors in bringing both the hospital and the school team together as one. We've included a list of resources that you can certainly visit, some books to read and some websites to visit after this to gather some more information, and we hope you find those helpful. Thank you very much for joining us today, and you'll see our contact information along with the website for our program should you have additional questions or concerns.
Thank you so much, Mary Beth. That was an excellent presentation, and you certainly did cover quite a bit of information in a very short amount of time. Now what we'd like to do is move into the question and answer portion of the webinar. We have had a number of questions submitted during the webinar through the questions function of the control panel for attendees. I've also had people emailing me. It's all great. Just want to rest assured, if you've been emailing me your questions, I have been channeling those to Lisa and Mary Beth. Again, please remember that if your question is not answered during the session, we will do our very best to provide answers to all questions via email within the week. Mary Beth and Lisa, why don't you take it away, and we'll spend about 10 or 12 minutes doing some answers to some questions that have been submitted.
Hi, everyone. We have had a bunch of questions, and try to get through as many of them as we can. I think we'll maybe start at the beginning of the age spectrum and kind of go up through the end. I'm going to switch to a speakerphone function here so we can get Mary Beth and I on together. So hopefully everyone can hear this okay. We had some questions about sort of the beginning of the age and sort of beginning kindergarten specifically, and questions around transitioning to kindergarten and concerns around behaviors around impulsivity and behavior outbursts following diagnosis and treatment for a brain tumor, and questions of, are those going to be things that will get better across time? And are those skills that my child will develop and will learn? And are we going to see some improvements in those areas as my child moves forward through school? And you know, I think one of the things, and part of why I wanted to sort of start at one end of the spectrum and kind of move to the other, is I think it is important to sort of look at some of the challenges that children who've had brain tumors face in the context of their typical development. And as Mary Beth mentioned when she was speaking, certainly when we look at elementary school years, and particularly kindergarten, we're looking at behavioral difficulties with some children in behavior management and as a developing and emerging skill, period. And then when you layer that on top of an insult to a developing brain, you can have even more difficulties and more challenges. And so what we often see is that children who've had a specific insult to that to the brain, struggling with those kinds of behaviors in the early elementary school years, and that with some intervention, especially early on, kindergarten, first grade, second grade, we do see some improvement in those kinds of behaviors. There may be other challenges that that particular child or those types of children will face later on, but the kinds of things that we see early on in terms of some of those outbursts and dysregulation do tend to diminish and decrease as those children get older and learn some of the skills to manage themselves. That said, we often find that having some behavioral plans put in place in the classroom can be very helpful. Having a lower teacher-to-student ratio in the classroom for that child may be useful. Working together with an occupational therapist or a school psychologist or a behavioral specialist at the school can also be very useful as that child really adjusts to the school and the school setting.
I think it's also important to note with the kindergarten population, for those students who are just starting school and were treated at a very young age, they were undergoing treatment and in a situation where they're primarily seeing their parent or their family-based support system, and may have missed some critical phases of development because they're in the hospital and they're not able to go to preschool and they're not exposed to that. So some of this transition does have to do with exposure and getting used to routines and transitioning into new expectations that, again, can mitigate over time once that child becomes more accustomed to that with the supports that Lisa had mentioned, of course.
So I'm going to flip really briefly to the other end of the spectrum because we've had a few questions about college. So I want to address that, and then maybe we can get kind of back to the, everything in between kindergarten and college. So we had a few questions about college, and specifically around, one, how to accommodate students in college. So obviously, it sounds like from questions we're getting that many of your children have either 504 plans or IEPs at the high school level, and you're wondering about how those children will continue to be accommodated at the college level. And then the second question around, if my child still has ongoing medical issues and medical needs that need to be accommodated, what can I do about that? And then finally, kind of perhaps similarly, what happens around things like SATs? Does my child need to take the SATs? Can they be waived from the SATs? And so on. So to answer the first question around a 504 plan. So while there is not technically 504 plans as they are written at the high school level, children, or I shouldn't say children, students are still are technically still eligible to receive accommodations, reasonable accommodations at the high school level, or excuse me, at the college level. The difference is that the student themselves must be the one to ask and advocate for those accommodations. But typically, the accommodations such as extended time or if when we're starting to talk about medical accommodations, if there's a need for a first floor dorm room or a single, if there's medical issues or things like that, or reduced course load because of fatigue. Those are accommodations that typically colleges can work with you and work with more perhaps directly work with your child around receiving.
You also want to make sure that your child has some updated evaluation prior to transitioning to college. So typically it's within 2 years from when they set foot on campus. You want to have an evaluation to bring with you to the Disability Support Center or the Academic Support Center to share so that the college can determine what your child is eligible for or your student is eligible for. Again, as Lisa mentioned, it really falls in the hands of the student at this point to advocate for themselves. And so working in conjunction closely with a disability officer or an academic support person will really go a long way in terms of getting the supports that they need.
And we strongly encourage our students and our families to go directly to the disability office at their school and work and talk with somebody there, even when they're looking at the school, to make sure that they can accommodate them in an appropriate way should their child in fact choose to go to that school. I know there was also questions asked about SATs and when SATs do and don't give an accurate and appropriate picture of a child and a student's overall cognitive abilities and what they're capable of. So there are a lot of schools that are moving away from the SATs and from requiring the SATs. Unfortunately, whether a school requires them or does not is up to their admissions policy, and whether or not a student is on an IEP or on a 504 plan can't necessarily change that particular academic or admission requirement. I certainly would, talk with the admissions office as well as the disability office if it's a school that your child is very interested in attending, as well as helping them understand why the SAT score itself might not be the most accurate reflection of the overall picture. But again, I think that they can certainly accommodate many of our students' needs, and perhaps that in and of itself gives you a good idea of whether that school will be a good fit for your child. We also received a question around whether, sorry, we're still getting in questions, and we want to be able to address as many as we can here. Questions around whether or not formalized plans should be put in place, and when schools say, you know what, we can accommodate, your child without, in fact, a formalized plan. This is best teaching practices, and we don't really need an official 504 plan to accommodate their needs. This is what we do, and it's no problem. We'll just take care of it. And I think we would still strongly encourage you to say, you know what, we'd still rather have this written down. We'd still rather have this put into a plan. It's important to know that, while you may know that this is what my child needs, a substitute teacher coming in for the day or next year's teacher coming in may not, in fact, know what he or she needs. And really, whenever possible, trying to formalize what's been recommended.
The beauty of a formalized plan is that it also goes with you. So when you move from, if you move from one district to another, that plan would go with you and would provide critical information to a new school team about what your child needs. I think we often in our program also hear what Lisa just mentioned, this is best teaching practice, but not every child's always going to get the best teacher, or what one teacher does versus another teacher is going to differ. And what a 504 plan or an IEP does is legally obligate the teacher to provide those services.
Mary Beth and Lisa, I don't mean to interrupt you. We have time for just one more question, and then we're going to have to wrap it up so that we finish up right on time at 1 o'clock Eastern Standard.
Sure.
Okay.
So we received a question about whether an IEP provides more protection than a 504 plan. And I think that's actually a great question asked by a lot of people and wondered about by a lot of people. So IEP law in 504, the regulations and laws that govern those two types of plans are different. 504 plans are governed by federal law, and IEPs are by special education law. So they're a little bit different in terms of the ways that they're implemented. IEPs tend to be very specific. There are goals. They tend to be much more detailed. 504 plans, however, ironically, tend to have more technical law behind them, but they're less detailed. So, I think it's a tricky question to answer because one has more detail, but one has the backing of civil law. So, Mary Beth, I don't know if you want to weigh in.
I do. That the most important piece in determining one plan versus the other is whether or not your child needs specialized instruction. So if you're really looking at what does my child need, if there needs to be a change to the curriculum or a change to the way your child is receiving the curriculum that is significant, your child should be on an IEP. If we're looking at accommodations solely looking at accommodations, then a 504 should meet those needs. Now, I think where that question was what that question was probably getting at is adherence to those plans, and we do see that because of an IEP is governed by special education law, there's a lot of supports in place to ensure that the school is providing those. I think a 504 plan, while very sufficient for many students, is not as closely overseen by educators.
Mary Beth and Lisa, thank you so much for doing a great job with the presentation and for fielding so many of the questions that have come in over the course of the last hour. We are still going to be taking questions. If anybody has other questions, you're welcome to email them to me, amy@akidsbraintumorcure.org. And as we said earlier, we will be sending around an email which will answer any questions that have gone unanswered today. So just in wrapping up, I hope everyone has learned a lot from the presentation and that the information will help all of your families navigate the academic landscape for your children. If you have any interest in helping us also raise awareness about this disease and or fundraising for targeted scientific research, it would be great. Next slide, please. It would be great if people could support a Kids Brain Tumor Cure, and some way on this slide. You can follow us on social media. Hashtag AKBTC is our Twitter handle or something like that, my social media guru tells me. So if you like to tweet, please tweet about this webinar, tweet about your child, tweet about how you feel about the fact that schools are or aren't supporting your kids, and we will tweet back. And the idea is for us to kind of work together to generate a groundswell of people talking about kids that are battling brain tumors. You can also like us on Facebook. These are all free ways to get involved. You can also look on LinkedIn. We have a company profile listed up there as well. And please don't forget, this is my one plug as a marketing specialist also, so forgive me, I've got a few hats I wear. If you shop online at Amazon, please go and instead of shopping at Amazon.com, go to smile.amazon.com, and all you need to do is select a Kids Brain Tumor Cure just once. When you go back to do your shopping the next time, or even that time, Amazon makes a donation to the foundation based on the purchase price of your order. It doesn't cost you a dime, not even a penny. They donate it all. It's fantastic. And then my last little plug is, again, another free way to help support a Kids Brain Tumor Cure and all of the research that we're funding, and that is to go online to www.greatnonprofits.org and just vote for us. It just takes 2 seconds. Give us 5 stars. Just say, hey, great webinar, or provide services that are not found elsewhere, or whatever you like that is supportive. The idea is that because we are a great nonprofit, we will get increased visibility. And again, the idea is to get a groundswell of people understanding the challenges that you as families and your children face, and the challenges that we face as a brain tumor community to find more effective treatments and a cure for all children battling brain tumors. So once again, thank you so much for your time. I think we're ending just about on time at 1 o'clock Eastern Standard. Have a great day, everyone. Thanks again.